So I'll start by welcoming you to our session on healthcare service navigation for newcomers. And it's a really great opportunity for us to learn about some available tools and innovative programs in the community. So I'm happy to introduce two specialists in this field from the Mississauga-Halton Healthline. So we have Tho Nhan and Alicia Piankowski, and they're both here as information and referral specialists from the Home and Community Care Support Services at Mississauga-Halton. And so we're really excited to learn about the Healthline. And I'm just going to also mention that we also have Payal Patel here from CarePoint Health, and who's a nurse practitioner there. And she's been very engaged with all sorts of support for newcomers, including refugees. And we're really excited to hear about an innovative program related to primary care. So I'll start by introducing Tho and Alicia to start us off, to let us know about the Mississauga-Halton Healthline. And this is an incredible tool that I think many of you will find useful in supporting your clients finding healthcare supports.
Hi, so my name is Alicia Piankowski. I'm the information referral specialist, and I'll do the first part of the presentation about navigating through the Healthline. I'll share the screen with you. Can everybody see the screen?
Yes.
Okay. So the Healthline is a provincial tool. It's administered by the Healthline.ca, and we just and this is where all the health social services are gathered. So we want this to be a single point of access for health and community services across Ontario. And across Ontario, we have 14 of those, same like we had Fort and Lynn's, now is the Home and Community Care Support Services. And each region has their own database. The database is, lots of information is shared between the different regions because they do overlap, or they're just, there might be services in certain area, but they provide services to the ones neighboring to them. So we share a lot of records with Central West region, or Toronto Central, or Central, and there are some the provincial records that are shared with all of them. So if the visitor to the site is not sure which site or which region they belong to, they can put the name of the city here or enter the postal code, and it will take them to the Healthline where they reside. And this is a homepage of the Mississauga-Halton Healthline.ca. And basically, anytime anybody's doing a search and want to go back to the to this homepage, they just click on that Mississauga-Halton Healthline.ca logo on the top. It will take them back from their search. So it shows different categories here. Here on the top, we have all the different sub-regions within the Mississauga-Halton region. So if you want to have the search more region, like area specific, you can change that. Or if you want all of Mississauga-Halton, you just leave it on the first tab, which is Mississauga-Halton. Our regions include Halton Hills, Milton, Oakville, all of Mississauga, except from Malton, which is part of Central West. And we have a South Etobicoke, which is south of Eglinton and west of Islington. So this is all the categories that you can find information on. And here's our map. database content. So we have over 47,000 profiles of organizations and programs, and more than 5,000 are displayed on the Mississauga-Halton site, on our site. There's more than 350 categories of information to help you with the search. And the service area maps help also with the search in your own neighborhood. We partner with different websites, integrated tools and resources that add to the information you find. So for the Mississauga-Halton region, we partner with Halton information providers and with CDR. We have over 11 million visits to the sites in the last 12 months, 1.4 million sessions in the Mississauga-Halton area. So what can be found there? So we have healthcare, hospitals, walk-in clinics, long-term care homes, home and community care, which is in-home nursing or it's home and health, adult day programs, meal delivery, food care, regulatory bodies and professional associations, public health promotions and preventions, disease and condition specific services. Then we have mental health, addictions, violence and abuse services, population focused, so women, indigenous people, children, youth, people with disabilities. And basic needs and social supports like food banks, shelters, employment, education. Also information and government services, libraries, municipalities, legal, health, coverage, and planning. So how can I find what I need? So there's different ways of searching for what you need. So I mentioned the categories before, but in order to search in the categories, one has to be a little bit more familiar with those categories and what they may contain. Like I know that under healthcare facilities, I can find hospitals, I can find nursing homes, retirement homes, but sometimes people don't just not sure which category to look in, which is fine. If you're going and you want to see what's under seniors, yes, that's good way to start, and it will expand from there. But so definitely it's a good way of searching, but for somebody that's using it for the first time, it may not be so easy. So another way of searching might be through the search box. So you can enter a topic here or just a keyword. If you're looking for food care, you can just enter food care, and different choices will come up for you. And as I mentioned before, you can narrow down your search to the different sub-regions within our Mississauga-Halton area. So you can just specify the Halton Hills or Milton or Oakville or so on. Also, if you're looking for a specific service, you know, or you might know the name or just the first word of this service, you can do it by the alphabetically. So on the bottom here, if you enter, let's say if you know the name of the agency starts with a G, you just go in there and you can find it there. There's also, you can find services across Ontario that will take you to the map that I showed previously with all the different regions in Ontario, the 14 different sites. If you want to click on the Find Services Near Me, it will allow you to search certain categories and entering your postal code. So it will show you services closest to you, or where you live, or where you want to find the service. Maybe it's close to your work, so you can enter that postal code. Also, just want to mention, there is on the top, there's a help button. That's where you can find, there's a video there where you can find information about how to navigate through the helpline. So if this session, if you miss anything in the session, and we probably won't be able to cover all the details, you can watch a short video. It will show you how to use the site. And also there is a clipboard. And if you click on that, it will also show you how to use the clipboard. And basically that lets you mark certain services if you want to share this with somebody else or just save it for yourself. I'm just showing an example of a search here. So let's say if I'm looking for fall preventions and exercise programs. It's enough I type falls in the search area, and different choice, and this is the result we'll get. Or if you just put falls prevention, this is the results you get. You get recommendations, you get topics, and then here below you get search results. If this is the agency that you were looking for, yes, you can click on that. But if you want to look at the whole category of what's in the category of exercise and fall prevention, if you click on one of those links, the whole list will come up. It will show you all the different services for exercise and fall prevention programs available for the region. And then once again, once you're in there, if you want to specify just to the city, let's say if you're just looking for Halton Hills, you can click from there, just Halton Hills, and the search will narrow down to those services only. Another example, again, not sure what to type. I just put immigration. You don't have to be very specific. You don't have to put the whole, refugees or so let's say if I just type immigration, the results we'll get, again, we get recommendations and topics. So for recommendations, immigrant, newcomer, and refugee services, this is a whole category of services. So it came up here again. Also, other topics that they're suggesting that you might want to look under is English, French as a second language, training programs, translation and interpretation services, personal identification certificates and licenses, where you can get that, and employment assistance. So the system thinks those are relevant to the topic that you're searching. And from there, you can click on the specific category and you'll get a whole list of agencies, services that do provide those kind of services. This is a search by category, which I mentioned at the beginning. So let's say I just want to go to the specific category. In this case, we'll do seniors. It opens up, there's all subcategories, what you can find under seniors. So what we thought it's relevant to what seniors might be looking for. There's the list of different categories. Mind you, some of the categories may show up in more than one area. Let's say adult day programs, they'll be also under facilities. So they're not only because they're under facilities, but they're also very much related to seniors. Or Alzheimer's disease and related dementias, they would be under different areas. You can find them under different areas as well. So from the previous screen, we chose caregiver support services because that was under seniors. That was one of the suggestions or one of the subcategories related to what services seniors may require, or the caregivers that are looking after them. And once you're in that category, again, you can narrow down this search when you enter your postal code or community here. So you can do it through the tabs, or you can do it through this area where you can filter down your search. But if you don't filter, even if you go down the list, it will show you the main information, like the name of the program and where the office is located. There's also suggestion that will show up here always with every search. In this, they also suggesting respite care and also directing you to caregiverexchange.ca site. This is when you open up, this is one of the programs or services listed under caregiver support. And we showing here first link, which is a program under Alzheimer's Society Payal. It shows all the details of the information. So basically the phone numbers, fax, whatever information we had for the program, what was provided to us that was for us okay to share with the public, we posted here. So you can directly go to the service website. This is the hours, the description of the service, and we usually indicate if there is a fee or if the service, if there is a charge for service. So that will be indicated under the fee area. Application, how do you apply? Do you need a special referral? Do you just call in yourself? There's a number of services that will require physician's referral. So that would be indicated in this area. And also eligibility. There's specific programs that are only for specific population. Let's say some are 55 plus or youth up to 18. So we'll try to specify it in this area. Also languages. There's services that provide language, their service in different languages. So we'll list them here. Area served, in this case, it's region, Payal and Halton region. Sometimes if it's not specific to the area because they don't, there are some services that will be provided at home. So we're more specific with the area served. If it's, let's say, a pharmacy, we won't say, you know, Mississauga only or Oakville, will say Mississauga and area. That means because anybody can come from anywhere, basically, to that service. And this is if you want to do information sharing. As I mentioned, it can be added to the clipboard. And here's the clipboard. Once I click on add it to the clipboard, it shows a number of records I added here. You can add, I believe, up to 15 records to the clipboard, and you can email that to someone or yourself, or you can print that information. And that we find this helpful, especially in our information and referral area where we have people calling, looking for specific resources. We try to gather those information, and if they want them emailed to them, we'll just send one email with all the different agencies linked to that email. Also, this was, we were under health services. We have other areas here. We have something that's called health resources, where we try to put information or documents that we find people may find interesting or helpful. Let's say stroke resources, caregiverexchange.ca, flu clinics information. We update this every year. So coming fall this year, we'll update this to the flu clinics information 2022-2023. There's also, I think we have about right now about 20 documents, and the last one we added is actually Newcomer Guide to Health and Social Services in Mississauga area. And you can follow home and community care because we are part of home and community care support services. So you can follow us on Twitter. You can contact us through Facebook. And this is emailed specifically to the Healthline. So that will be myself and Tho. So that's our email. And we can also be reached by directly by the phone number. That's our organization main phone number, my extension and Tho's extension. So we're here every day to help with inquiries, questions, because we get also, we are administrators of the database, but we also provide information and referral as well. So people can call us directly or send us emails if they have any questions. Although we always direct people to the Healthline, we're able to assist with searches if it's something that cannot be easily found in the Healthline, which we can try to help to find that information ourselves. Okay, thank you.
Thanks so much, Alicia. And Tho, I wonder, we have a bit of time, so I wonder if there are any questions from the group. Feel free to come off. You can raise your hand and you can ask the question aloud, or you can put your question in the chat box. Maybe while people are thinking of their questions, are there common questions, Alicia and Tho, that may relate to newcomers that you receive from time to time?
Yes, okay. So first of all, my name is Tho, and I also, an information and referral specialist, and I work with Alicia. So, like basically that our, the responsibility is that helping, people, including the public and maybe, like healthcare professional to navigate, the system and to find, information and resources to help their patient, to help, their families and whoever, newcomers and refugees. We also, spend a lot of time, maintaining the database because, we also partner with the Halton and the CDR-CP, the Pew database. We share, records with them and we maintain them. So in order to keep the information, current and up to date, then our main task is adding new one, updating, maintaining them. So I can share my screen and show you a little bit, maybe just to add to what Alicia already mentioned to you so that you get an idea of, what to find.
Perfect. Yeah. And then we can go to questions from there.
Yeah. Yeah. Okay. So this is something like you see, like this is my screen. You see my screen, right?
Yes.
Yeah. Okay. So, like in here, like Alicia mentioned that they have many, like categories and then subcategories and many things. And then the good thing is that you can, if you find something that, like you are interested in, or your patient or your client is, you can save it to the clipboard and then you can print it out later or email it to them. Underneath here, like on this side, you can connect with us, like we also have special, like directory. This one is just only for specialists in our area. We also have the Ontario Health Team. We put it here with the Connect Care Halton. We also have different, things that you can find it in here. For example, that one of the questions that some people they may ask, like for example, I am a refugee or maybe I'm a newcomer and I don't have, like OHIP, and I need medical, attention. So where do I find it? So, that's mean that's something that you don't have an OHIP, you can put it in, like OHIP, or you can put, like free, we just put, like free. It will come up, something like that, free medical. You see, it will show you, like some of the walk-in clinic or something related to that category. But the first, record that you get here is at a free medical clinic. and you can click on that, and you can find that, you know, which agency that they provide that. They give you the address, the website, the phone number, and also, you know, like their hours, if they specify their hours, and then additional information that you need to call to book an appointment. And then, you know, like a brief description of the services provided by the clinic, something like that. And if something important, then we will, you know, like highlight it here. We will bold it so people will see it right away. And then, you know, some other thing that we say that no walk-in, or people, you know, with OHIP, they do not, you know, like provide service, something like that. You know, like those are the things that we will find that, you know, like many people will ask about, you know, like medical care. If they are a newcomer and they don't have the OHIP yet, then they will ask for this. And this is something where you can find it. Or maybe that, you know, like people can ask for, you know, like in-home hairdressing or foot care or something like that. They just put, you know, like in-home, and then it will show, you know, like many, you know, in-home personal support, nursing, anything like that, you know, in-home haircut, foot care, it's all in here. So, you know, like you can always narrow down, or if you want to go back to the main shirt, you just click on the logo here and it will show it to you. So and then anything related to COVID, right? Because it is, you know, like current. So we put, you know, it here, and then there's the link to different websites, you know, like how you can do that as well. But I find that, for example, you find, let's say a pharmacist or paramedic services, you click in here. Okay, so let's say that you choose this one and you click on that. And then you can add, like Alicia said, you can add to the clipboard. It will show it here from the clipboard. And then you can put a note here that dear, something like that. And then after that, you know, like you have one record here, or you can keep on, you know, adding, or you don't like it, you remove it. And then after that, you can, you know, like send it to the person, you can bookmark, and then you can email or print out a list. So those are the, you know, like I find that most of the questions that people will ask, but of course that, you know, like it's, there are many other questions they may ask. And as Alicia mentioned that if there's something that you find that, you know, like you cannot find it in the helpline, or if you need our help to help you to find the specific resources, because not, you know, like every region or every services or program are available to everybody or to every, you know, like community. They also have restriction, or some services specifically, they have it in Toronto, but they don't have it in our area, and you cannot find it in here. Then you can ask us by, you know, like you contact us here, and, you know, like everything is in here. You can send us an email, phone us, or you can, you know, like follow us, you know, like by Facebook or something like that. And then we will do our best to help you to find the information you need, or to refer you to the appropriate, you know, like agency or resources. Another one I want to mention is that there's also a section for the French speaking, you know, like clients. So if you click on this one, it will show you the database, but in French. And also there's an important part that, for example, you have a, you open up a new retirement home, or you have a new service and you want to be listed in the database. You can also, you know, submit your content here, and, you know, like you can suggest an update, you know, like it's already been existing in the database, and you find that the information is out of date or is no longer correct. Then you can suggest an update, or you can, you know, like fill out a new service profile. And then you answer a couple of questions, you know, like those are the questions. They have the question mark here, like the help button and the description. And then, you know, like you can click on this, and then you submit the service to us. And, you know, like after that, it will come to us, and then we will, you know, like add the service in the database to expand. Okay, so thank you. I know that it takes a lot of time, but I will, like I said, that if you feel, like you cannot find something, feel free to contact us, and we will, do our best to help you. Thank you.
Thanks so much, Tho.
You're very welcome.
So there's a few questions. Maybe I'll take Gurpreet, who has patiently had your hand up. Go ahead, Gurpreet.
Thank you. Thank you, Jessica. Yes, it's a great website. I frequently use this website for newcomers or refugee convention status clients. And like even the physiotherapy, most of the clients asking who are not extended coverage like benefits from the employer or something. So it's a very helpful website. Only the point is that even few workers also wrote in the chat box that like, for example, when we are find out how to find a doctor based on their postal codes, some of them I know they are not accepting, right? So that is only the challenge going on. So but still we try our best to give maximum like website navigation, how to give in the navigation, and also introduce the settlement.org website to them as well. So if in case they want to do more research, so they can do by themselves as well. So if they cannot wait for us for further assistance or information. Thank you. Thank you so much.
Thanks for your thoughts, Gurpreet. Anything to add, Tho or Alicia, on that point?
I just want to mention about the comment about finding a new doctor. The search we have is for specialists. So if you have a patient that's looking for a family doctor, there's a program that we have under Home and Community Care. It's called Healthcare Connect, and we have 2 care coordinators that have take care of those requests. So that information can be found. There's a Healthcare Connect, I believe, like a button on our helpline, or if you just call our main number, you can be transferred to one of the Healthcare Connect. It's a provincial program actually. So each home and community care has those care coordinators, and they're the ones that are trying to find, if needed, language specific doctor that speaks their language, if that's possible at all, because we know there's shortage of family doctors. So yeah, but we'll try, and also in their area as well.
That's great. And that answers a question in the chat box about the linkage to Healthcare Connect to help people find a family doctor. The question related is, are there other languages available? So Martha, I see your question. Is that related to family doctor or to services in general, or the web portal?
The web portal. I was just wondering whether anyone had access. Like, do any of your workers speak different languages, or are there a drop-down menu, or are you looking at that to include different languages besides French?
Yes. Okay. So we just only have, like the French language there, but like for every other records, if we find that like if the service they provide like in other languages, then we will try to specify that. Maybe we can put like staff can speak a variety of languages, but we only have the French like language on our website. That's the like the official one that we have, but we don't have any other like languages. But we can like if people asking, then we can like ask them to use like probably to use the Google Translate like to help translate some of the information that we have on the website, and then hopefully that it will can help them. Or if we can ask, like people to contact some of the agencies serving, like newcomers and immigrants. And then, like, of course, that they have staff speaking different languages, and then they can help, like people as well. But we only have the French, on our website.
Great, thank you. That helps clarify.
Yeah, thank you. You're welcome.
All right. Patricia had asked in the chat box about, Neelam, about how to find services in Malton and Brampton. Is that, I'll let you answer that piece.
Yes, okay. I'm sorry.
Go ahead. No, go ahead.
Okay, thank you. Okay, so regarding about, because, like that's the geography that fall under each, like home and community care. Also that Malton is part of, like Mississauga. It's just like, like Caledon is part of, like the Peel region, but it's belong to a different lane, like mandate, it's different geographic boundary. Like, for example, that we are Halton, but we do not, cover Burlington. So, like Burlington belong to, like Hamilton and Honeyman and Norfolk. So that's why, like we ask people to put in their postal code, and it will direct, like people to the right, like helpline, or to the right, like home and community support services that cover their services. That's the way that we can do. I just want to share my screen quickly, and then to show it to you again. That, like under here that you can see it. And then if you go back to the main, like logo here, I just, find it, like, for example, like the question before, people said that how to find, like doctor accepting new patient, it's here. So, like you can put it in here, doctor accepting new patient. We have the care connector that help the patient to find, but you can also look it up here. If you go back to the main page, and then, under the 5 services near me here, like just put, like the Burlington or Malton or the postal code, and, like it will direct person to the right, like healthcare in that area and then there's a contact. You can call them and ask for more questions, and then they will direct you to the right place. So, like those are the things that, like we help people those to find, where they belong to. Yeah, thank you.
Thank you.
You're welcome.
Great. And I think there's more questions about finding family doctors. So I think the next presentation by Payal might help a little bit around an innovative program on that. Knowing that there is a context of shortage, as Alicia mentioned. Martha's asking to clarify, and her question's in the chat box. So home and community care, as you mentioned, does that replace LHINs or the local health integration networks that used to exist as an entity title?
Yes, but now we are officially called Home and Community Care Support Services, and then let's say Mississauga-Halton or Central West. So there's no more LHIN. Part of our staff went direct to Ontario Health, and the client services stayed with Home and Community Care Support Services.
Perfect, thank you. The healthcare system's always evolving, so it's good to keep up with the changes. Great, any other questions for Tho or Alicia? Great. Okay, well, thank you so much. This is an incredible tool, and I know there's a ton of work in the background with maintaining the databases to keep them up to date. And if you ever need, I guess, support around settlement and being aware of which services provide which languages, you can reach back to us through Peel Newcomer Strategy Group, as we're connected to many of the agencies around this webinar today. So lots of expertise all around. So thank you, Tho and Alicia, again. So you'll be here if there are other questions as we go through the rest of the webinar. Thank you so much. And thank you so much also for sharing your contact information.
You're welcome. Thank you.
So next I'm going to introduce Payal Patel, who's the nurse practitioner in primary care at CarePoint Health. And she has diverse experience in primary care, care of the elderly, chronic disease management, women's health, and palliative care. And she's compassionate and passionate about providing evidence-based, holistic, person-centered care in a collaborative primary care setting, which really exemplifies CarePoint Health. And she's here to talk today about an innovative program for clients and newcomers who are affected by social determinants of health and are looking for a family doctor. So I'm going to let Payal introduce the program and speak a little bit more about CarePoint Health. Thanks so much, Payal.
Right. Thank you, Jessica. Can everyone hear me? Okay, perfect.
Yeah. Yeah.
I'm just gonna get right into it and share my presentation today, and all about CarePoint Connects. Okay. I'm trying to do this. Okay, there we go. Just sharing this as a slideshow. Right. So I just wanted to share a little bit about CarePoint Health before diving into our unattached patient program. So CarePoint Health is an interprofessional care team that is situated in Mississauga, which supports the patients of physician in Southwest Mississauga and East Mississauga community. From the time that we actually opened up, which was back in 2019, that group has expanded significantly, and so now we have about 70 affiliated physicians, and on a almost like a daily or monthly basis, we do add like more physicians in the community as part of like CarePoint Health affiliated physician. The team serves patients holistically by focusing on both medical concerns and needs related to the social determinants of health. CarePoint Health builds on the philosophy of the patient's medical home, where the patients receive the care they need throughout their life. CarePoint Health will support patients by connecting them to a coordinated, comprehensive team of healthcare professionals upon whom they can rely and work with to achieve their personal health goals. The goal is to achieve the quadruple aim of increased patient satisfaction, improving population health, reduce healthcare costs, and improving provider work life. So where this program started is we were just looking at sort of like the gap and how we can serve the community within Mississauga a little bit better. So as nurse practitioners, we started looking at, you know, what is really like the number of people that are within Mississauga who are still looking for a family doctor. So when we had initially started looking back in February 2021, just to doing like a general environmental survey, I think the patients or the clients that were listed within the Healthcare Connect who are still looking for a family doctor were about 2,000 clients. When we last looked July of this year, that number has surely increased, and it's about like over 3,000 clients within just Mississauga-Halton region in Healthcare Connects that are looking for patients, that are looking for physician. And now, mind you, this is only within Healthcare Connect. I'm sure that number is much higher, especially for like clients who've not been registered with Healthcare Connects, right? And some of these patient population are quite complex or vulnerable, and many of these clients use emergencies or walk-in clinics to address their primary care needs. So CarePoint Connects at CarePoint Health is our unattached patient program that is nurse practitioner led program. It's designed to wrap care around patients in our community who have challenges accessing care for their primary care needs. It is a program that uses a team-based care approach to address patients' physical, emotional, mental, and social needs. It is a time-limited program, so we're saying that depending from patient to patient and their care needs, a nurse practitioner at CarePoint Health will start seeing a patient, start addressing their concerns and creating a care plan. And while they're seeing the patient, they would likely internally connect the patient either through a physiotherapy or a dietitian or a social worker or a psychologist or chiropodist, depending on their needs and if they meet the eligibility criteria, and start developing a care plan for that patient. So a care has been well coordinated before the patient is ready to be transferred over to one of our affiliated physicians. So once a care plan is in place, we will leverage our longstanding partnership with our affiliated physicians in the Mississauga region to match each patient with a new family doctor. Patients will continue to benefit from the team-based care by CarePoint Health through their affiliated physician. And the goal of the program is to create a stable primary healthcare environment for patients who need extra support. So the idea behind it is that especially patients who are either newcomers or clients who have significant comorbidities, who otherwise often have a difficult time finding a family doctor, or who would benefit from a team-based care, but are not able to because either a CHC is not accepting a patient or a family health team is not accepting a patient, they can come over to CarePoint Health. We can start providing that care, have a team surrounding that patient care, and then once that care has once the patient's concerns and needs have been addressed, can now be transferred over to a family doctor that's affiliated with us. A family doctor is more keen on taking on that patient because they know that the patient's needs have been addressed. There's a care plan that's already been set in place. There is a team that's following this patient over at CarePoint Health. And because we have that relationship with the physician, they're more open to accepting that patient as well. So the benefits of this program is that, of course, patients have increased access to primary care providers. They receive immediate and long-term wraparound care, addressing their medical and social needs, matching of patients to a compatible physician, coordination, support for affiliated physicians who want to grow their practice, and of course, a seamless transfer of complete patient medical files to a new physician. It builds partnership with the Mississauga-Halton partners, and it helps reduce the number of unnecessary emergency visits, but also like a use of walk-in clinics, and overall population health improvement with Mississauga region. So I just want to share with you guys our referral form that we've created. And so currently we do have few agencies that are partnered with us, Mississauga Legal Clinic, Polyculture, to name a few, and there is a Catholic Family Services as well. And so what we ask is that a referral be completed by the agency, just identifying the referring agency, some client information, and a consent from the client for us to be able to kind of review some of their medical records if they've been seen here. So we can review Connecting Ontario. If not, then we request that the agency share whatever little information they have. So in past, we've had clients from Polyculture where they have been like new, they were refugees, they've had an OHIP number, and they'd come in, they'd referred to this program. And so they were fairly healthy. There wasn't any past medical history, and that's what they would just put that down into like their relevant medical history as well as like the reason for referral. Our eligibility criteria is we wanted to simplify it as much as possible to expand the patients that are eligible for this program as well. So the only eligibility criteria we have is that the clients agree to be connected to a primary care provider affiliated with CarePoint Health. Now, this list of physicians can be found on our website as well under Meet Our Team. That they also have a valid OHIP healthcare coverage. We are looking to see whether we can expand that for clients who have IFH number, but so far we are only able to accept clients who have a OHIP number. And that client consent to having their medical records reviewed as part of the intake process. And our only exclusion criteria is that the client is not actively suicidal or is not risk to harm self or others, and or has not had manic episodes or psychosis within the past 6 months. Partly for the rationale for that was because we are not able to provide those services in-house. And so for that reason, we did not want to take on those patients, or especially when we can't provide those kind of services. On page 2, so the back side of the page, we have our eligibility criteria as well as our like program information and a contact information. So if you have any questions or concerns, you can always sort of like email us, and we'd be more than happy to answer those questions for you. So I also wanted to just share like a client scenario, just to walk you through exactly how this process works, and from the client perspective, but also from like the physician perspective, how beneficial it was. So we'd received a client referral from community. She is a 52-year-old female who was going through shelter while awaiting renovation of her rental apartment. She had not seen a family doctor in about 5 years and was previously treated for diabetes and other comorbidities. She wanted to start seeing a family doctor partly because she had a fall about 6 months prior to coming to us and was admitted into the hospital, was told that her diabetes is at a critical level and does need to start being treated before she develops any complications from her diabetes. We started seeing her in March of this year. So we had just started with like an initial meet and greet, which we offer either in person or over the phone, where we review our client agreement, and then from there on, we booked an in-person follow-up with the patient. So I started to see the patient in person, started addressing some of the main concerns and goals out of looking for a family doctor. Started by completing a female preventative care checklist. We found out that, she hadn't had any sort of like preventative screening in the last 10 years, or that she could recall. We started off with a cancer screening. So her cervical cancer screening, breast cancer screening, colon cancer screening were completed. We conducted some generalized blood work based on her age. And then consecutive follow-ups occurred, whether it was over the phone mainly or in person, partly because of the accessibility, as she was still going through different shelter system, and she was appreciative of that flexibility. But also the fact that I was able to kind of follow up more closely and monitor her with regards to her diabetes. So I started her on treatment for her diabetes, made a referral to LMC for an endocrinology team. She started seeing our dietitian here at CarePoint Health. She also started seeing our social worker here at CarePoint Health for some counseling, dietitian for our nutrition services, because her diabetes was very well uncontrolled. As part of her cancer screening, we found out that her cervical cancer screening was abnormal and so needed further referral to gynae, and we did that. And then just over the course of the 6 months that I have been seeing her, we were able to actually bring her diabetes well below, at least within the normal range. And we're still working on it. And so she's been quite appreciative, because she didn't recognize that, how much that she actually needed to be looked after in terms of her care needs. And especially with regards to the cervical cancer screening, it was an eye-opener for her that, that could have had a potential for developing into a cancer, which got addressed at in a much quicker manner if she hadn't, compared to if she hadn't seen a primary care provider. So now at 6-month mark, there is a very well-organized care plan for this patient, where she's received all the preventative care, but she's also has a good team that is supporting her with her diabetes management, as well as for her mental health support. So I've been having these conversations that, we are ready to have a transition over to a family doctor. I've met up with one of her family doctors who is who's still accepting new patients. So we did conduct an in-person transfer of accountability with the affiliated physician, provided them with a care plan, and they were happy to start taking care of this patient or start seeing this patient, because they see that, majority of the work has already been done. And so now we're just in the process of transferring the medical records to the affiliated physician and setting up a meet and greet for the physician and the patient. And so I just, that was the end of my presentation. I just wanted to say thank you for having me here, and I'm more than happy to answer any questions.
Super, thanks so much. There was a question about whether the program is free to clients, Payal.
Sorry, free to clients. Do you want to elaborate on that?
Neelam, do you want to come on and ask your question?
Yeah, sorry, can you hear me?
Yes.
Yeah.
Okay, I just wanted to know whether if so you get a referral, and as you mentioned that they should be have a valid health card. Plus, if not health card, then FAU take those client as well. So, do you charge anything from them
Okay.
for the
No.
services?
Yeah, so our services are free of charge. So currently, unfortunately, we only do see OHIP patients with a valid OHIP number. There have been occasions when we get patient referrals from our affiliated physicians who are seeing an IFH, and even on those, for those scenarios, we do not charge fees, right? But for our interprofessional team members, we do have eligibility criteria. So especially for our physiotherapy, our dietitian, and our social worker team. So if they do have like an existing ODSP application, or if they have extended benefits, then they won't be seeing those patients, because we want to truly increase that accessibility to patients who don't have any of those and would benefit from physiotherapy, or from seeing a dietitian, but otherwise are not able to afford to pay for those services. Does that answer your question?
Yeah, thank you very much.
Sure. Thank you so much. There was an earlier question, but maybe before I get to that one, Payal, if an organization wants to be a part of the CarePoint Connects program, how might they start that connection so that they can start using the referral form and that sort of thing?
Yeah, so I think one of the things we're working on is actually putting our referral form on our website. Currently, we don't, because we're still working on our website. But what I can do at the end of the presentation is I can share a referral form with you, Jessica. I'm more than happy to even share it in the chat. It's a simple PDF. It's a one-pager. We wanted to try and keep it as simple as possible, but we do ask that it comes from an agency, just so we can have a little bit of a rapport with the partners within Mississauga or Halton, a bit of a partnership on that end. But also, if we're not for some reason able to accept a referral, we can provide them with the rationale as to why we can't. It's happened on a very seldom basis that we've not been able to actually accept a referral, and majority of the patient population that we have accepted have actually truly benefited from this program, because they have come from a very marginalized population.
That's excellent. And you're hearing kudos in the chat box from Pravina, for example. So that's great that the program's rolling on very well. Just wondering around that connection to the different agencies, so that there is that rapport. Is there someone who it would be good to meet with from the organization prior to using the referral form, or could that be a starting point, is around discussing the referral form and who the main contacts might be at a settlement agency, for example?
Yeah, for sure. So currently, because we're in such an infancy phase of the program, I am one of the main contacts, and so that is part of our referral form as well. But we do have physician engagement specialists as well, and because they actually engage with a lot of our physicians, the idea is that hopefully they would be the point personnel. So currently, as I meet with other agencies, I do offer that if you do want more information, or if you just want your staff to be well acquainted to this program, I'm more than happy to come in if at your request to your team meetings or what have you, to just give you a bit of an understanding of this program. We truly see benefit of how this program can support a newcomer, especially when I supported the refugee program at the hotel. I saw a lot of population, especially in their mid-30s and 40s, having significant comorbidities, and would really benefit from just an ongoing primary care services, but also a team-based approach to care. And I felt that this program would be quite beneficial to those patients, right?
Absolutely. And it's great to hear that you're already working with polycultural immigrant and community services, for example. And so would it be helpful from the settlement agency side to have a main contact? Was that something that was very useful in the program getting going? So maybe that's something you'd be interested in moving forward if an agency is interested in working with CarePoint Health?
Yeah, and like, so we've been very closely working with like, especially like Mississauga Legal Clinic, because they get quite a bit of population that's marginalized or have been affected by social determinants of health. And oftentimes like the social worker would just email me of a potential referral and would tell me that, you know, I have so-and-so client, what do you think? And I would tell her, you know what, for sure, go ahead, fax the referral. We'll review it. Our wait times are fairly quick as well. So we do say just give us about a week for reviewing of that referral. And we do fax back, whether it's a decline or acceptance. If there is ever a decline, we don't like to say that we're just declining a service. We do provide with other resources. So one of the things we do ask that, you know, it is a patient that's looking for a family doctor. If they do have a family doctor, but it's not sort of like, you know, agreeable to who their family doctor is, we want to try and truly reach the population who doesn't have a family doctor, right? Because that percentage is just increasing by the day, and the complexity of those patients are increasing by the day as well.
That makes a lot of sense, especially in the shortage of primary care physicians out there as well. There's a question here for, maybe it's for Tho and Alicia as well. So it's great to hear about CarePoint Health's program, but there's a question about community health centers and whether they're taking patients that reside in that neighborhood. And I wonder if there's information on that on the Mississauga-Halton Healthline web portal.
Yes, okay. So, you know, like usually that we don't have that, you know, like information, but, you know, like we can, you know, like call the community, you know, like center and ask them if they can take, you know, like patient from the neighboring, you know, like area. But we don't have, unfortunately, that we don't have that information, you know, ready on our website. But of course, that we can do some investigation by calling the agency and ask them directly and get back to the person.
And that might be a great follow-up session to this one, is really talking to the community health centers and what their eligibility is like, because I think it's beyond maybe just people who reside in their neighborhood. I think there's probably additional eligibility around really serving the most vulnerable.
Yeah, we have those listed in our Healthline, and there should be eligibility listed there.
Okay.
So that information would be available. If you look it up, then you'll be able to find which areas they service. There's some more specific that might do just by certain postal codes. And that would be listed on our Healthline. So yeah, they can be found. That information can be found on the Healthline.
Super. Maybe Neda can add to her questions.
Hi. Thank you for the great information. I was the one who asked this question because in the past I have referred the client. I work in Halton, and most of my clients, they live in Halton. I have referred to the community center in Mississauga, and that client was rejected. They said, we only serve people who reside in Mississauga. So we don't have any, you know, community health center in Halton. I think the closest one would be Mississauga. So if there is anything, you know, can be done to accept people, you know, like from Halton or other regions that they do not have, you know, community centers, that would be great, you know, for the benefit of the, you know, people, for the clients.
So if I may, like, so we do accept, that's one of the common questions we get asked as well by agencies in terms of like, do accept patients if they were to live in Burlington or if they were to live in Oakville or Milton. We don't really have a catchment area in terms of our like client population, as long as they are agreeable to be attached to one of our affiliated physicians, and our affiliated physicians are in Mississauga. So we see patients of our affiliated physician that's in like London or Burlington, right? Because people have moved, but they still want to like stay with the same physician. So, you know, if that may be of help.
Okay, great. Thank you so much.
That's great to hear. Thanks so much, Payal. And thank you, Martha, for your additional insights there. And Payal shared her referral form in the chat box. And maybe if the speakers can share your emails in the chat box as well, that might be an opportunity for people to follow up after the session as well. And we'll be sure to share the slides and the recording by email. And thanks to those who have already shared some feedback via the link that Shreya had put in the chat box. That's really helpful for us. So if you have any thoughts on future sessions as well, that's really great. Any other questions for Payal, Tho, or Alicia? And thank you again for such wonderful overviews of your work. Just curious for those here, is there anyone, maybe you could raise your hand if the tool, the Mississauga-Halton Healthline, is new to you. Just curious if people see this as a new tool that they hadn't seen before. Sounds like maybe everyone's seen the portal before, which is maybe a good thing. Okay, super. All right. So what I'm going to do is I'm going to be just speaking a little bit about an upcoming event tomorrow that Payal Newcomer Strategy Group is hosting. It's a community information forum, and it's really geared to newcomer serving organizations more broadly, whether you're working directly with clients or in management, or you're with another organization that's outside of the settlement sector. And we're looking at a possible modeling of the accountability and planning for settlement services. So right now, the federal government plays such a strong role through IRCC, and IRCC is looking to consult through local immigration partnerships like ourselves to see what it would look like if there was a regional model for accountability and planning. So there's an information session tomorrow morning, and Shreya is just going to add that to our chat box as well. And if you're interested in registering, we'd be delighted to have you to share information about our consultation project. And it's an opportunity to give your insights as well as this model starts to develop. And I think we're going to probably have a few minutes to give back to everybody, unless there's any final thoughts or questions.
Yes, I just want to add, like one point. As we mentioned, that because, information keep on changing almost, like every single minute, every day. So we rely on the community and on people who using the website. If they see something that need, like to be corrected, or feel free, like, because on our website, there's a button where you can submit a new records, or you can suggest an update. For example, you said that, okay, this doctor has retired, or they changed the office address, they have a new phone number. Then feel free, like to send us a suggested update, so it will come to us, to Alicia and I, and then we will take a look at that, and we will verify the information. And if it's correct, then we will update. So we try to keep the database, like on way to be up to date and current. And also another point is that on the records that in the database of the Mississauga-Halton Healthline, whenever that we have a referral form that the agency want to share, or we find that it is, like useful or beneficial, we will, like also upload the document as a PDF on the record so people can print it out and then use it for their client, like a referral form or maybe some brochure or some additional information. So those are my two additional points that I want to let people know. Thank you.
Thank you so much, Tho. And just to think about Peel region and Halton, your database covers Mississauga-Halton. For Brampton, would it be Central West?
Yes, that's correct. It's on the Central West. Central West covering, up to Caledon and Brampton and Moulton. Yeah, so that's belong to Central West. Like Burlington belong to Hamilton. But, we can always, direct people to the right, home and community support services.
Great. And just for Malton, which Healthline would that be?
It's on the Central West.
As well. Okay.
Yes. Yeah.
Okay. Super. Thank you so much. Amazing. Well, thank you so much, everyone, for attending and being so attentive to such an innovative project that Payal shared to finding family doctors for those who really need that connection, especially around the social determinants, and to Tho and Alicia as well for such a great overview of a really in-depth portal to find healthcare support. So hope to have you all back for another webinar. And if you have any other ideas for future sessions, whether it's about healthcare or other elements that would be helpful in your work, we're happy to coordinate around some of those ideas. We're actually planning a survey later this fall about professional developments as we plan into the next year. So look out for that in a month or so. Thanks everyone for attending. We'll follow up by email as well. Have a great day.